Good afternoon, everyone. I'm Ty Trainer Kane, and welcome to Ty's Online Tutoring Academy. We're doing a read-through for the CNA course, and we're just gonna continue from where we left off based on the previous videos. At this point, we're gonna do assisting with meals. So we're gonna go through these skill sets, and further on go on to elimination, and wherever this video takes us, we'll go into another portion of the lesson. Okay, it says assisting with meals. When assisting patient with meals, the nurse aide should focus on patient safety and independence. Many patients who require assistance to eat may have difficulties with chewing or swallowing, so the nurse aide should continually monitor for choking. The nurse aide should also follow protocols to ensure patients on special diets eat the appropriate food. Patients required varying levels of assistance with eating. The nurse aide should encourage independence by having the patient participate as much as possible. Patient may be able to select the food they want, eat some food by hand, or hold certain utensils or cup. So it depends on the nature of the patient. Other guidelines, general guidelines for feeding, are given below. 1. Match the patient's name to the name on the tray and check for allergies. So match the name. Next, sit facing the patient to watch for signs of choking. So we sit in front of the patient. Next, report signs of difficulty swallowing to the nurse. Next, review the contents of the tray with the patient and ask what they prefer to eat first. Defer to the patient's preference. Use a spoon to prevent injuries. Bites of food should be half of the spoon or smaller. For patients with impaired vision, describe what is on their plate and where it is using a clock pattern. Ensure the mouth is empty before offering another bite of food. Do not rush the patient. Encourage patient to drink fluids by offering fluids throughout the meal. Never give a patient a cup with hot liquid in it. Wipe the patient's face with a napkin when needed, and at the end of the meal, verify patient is full and document the percentage eaten. So skill evaluation, which is now feed the patient who cannot feed themselves. That's what we're doing. 1, we match the patient's name with the name on the tray. 2, which is in bold, we place patients in an upright position, high folder. 3, place the tray where the patient can see it easily. 4, clean the patient's hand. 5, sit facing the patient. And 6, identify food on the tray. Ask the patient what they want to eat first. 7, use a spoon. Offer the patient small bites of each food. Identify each food when offered. Offer beverages at least once during the meal. 9, ask patient if they are ready for another bite of food before giving it. 10, when done, clean the patient's hands and mouth, then wash hands. So we're going to go into a review question. Review question number 9. It says, when feeding a patient, the nurse aide should offer fluids. A, only at the beginning of the meal. B, only at the end of the meal. C, regularly throughout the meal. D, after each bite of food. When feeding a patient, the nurse aide should offer fluids: 1. Only at the beginning of the meal. D. Only at the end of the meal. C. Regularly throughout the meal. Or D. After each bite of the food. The correct answer is C. I'm just saying, yeah. When assisting the client with eating, fluids should be offered regularly throughout the meal to help the patient chew and swallow their meal. So we offer to drink throughout the meal. Okay, we're going into a different portion, which is elimination. So we're assisting with elimination. A bedpan is used for elimination when a patient cannot get out of bed. The bedpan is positioned under the patient when they need to urinate or have a bowel movement. Most patients will use a regular bedpan, but patients with hip or spinal injury may use a fracture pan. So we're going to do, for skill evaluation, assist with the use of bedpan. So when we're using the bedpan, we 1. Lower the head of bed. 2. Put on gloves. 3. Cover patients with a blanket. 4. Place protective barrier and bedpan under the patient's buttocks. 5. Remove gloves and wash hands. 6. Raise the head of the bed. 7. Place toilet tissue, the call light, and wipes within reach. 8. Ask patient to use hand wipes and press call button when done. 9. When patient press call button, wash hands and put on gloves. 10. Lower the head of the bed. 11. Ask patient to lift their buttocks or to roll patient to their side to remove the bedpan. 12. Empty the bedpan into the toilet. Rinse the bedpan and pour rinse into the toilet. 13. Place bedpan in appropriate dirty area. And 14. Remove your gloves and wash your hands. Okay, we're going to go now into using urinal. So men use urinal to avoid urine in bed. The nurse aide may need to assist the patient by bringing the urinal to the patient, assisting them into a sitting position, or position the urinal for the patient. When the patient is done, the nurse aide should note the output and empty the urinal into the toilet. Follow the appropriate protocol to ensure urine does not contaminate clean surfaces. If the patient can stand and transfer, they may use a commode. The commode should be positioned next to or facing the foot of the bed like a wheelchair. The nurse aide should make sure the wheels on the commode are locked before the patient leaves the bed. The patient can be assisted into and off the commode similar to a chair. Incontinence products include patient's diaper, liners, and protective pads, disposable or reusable, with an absorbent layer on one side and a moisture barrier on the other. Incontinence is a major cause of skin irritation, and most patients require a moisture barrier cream when using incontinence product. Okay, so we have another question. It says moisture barrier cream should be applied to a patient's perineal area, 1A, before a clean incontinent product is applied. B, before they use a commode. C, after they use the bedpan for a bowel movement. D, after a condom catheter has been secured. So let me repeat. It said a moisture barrier cream should be applied to a patient's perineal area. A, before a clean incontinence product is applied. C, or B, before they use a commode. C, after they use the bedpan for a bowel movement. Or D, after a condom catheter has been secured. And the answer is A. So that's before a clean incontinence product is applied. It says it's a moisture barrier is used with incontinence products to help prevent skin damage caused by moisture and bacteria. So that's before you put on the diaper or the liner, you put on that cream. All right. Urinal catheters. So it says indwelling catheters, forgive my pronunciation, are inserted through the urethra into the bladder to continually drain urine. The urine is collected in a drainage bag, which can be attached to the patient's leg or bed. The drainage bag must be emptied regularly. The amount of urine in the drainage bag may need to be recorded as a part of a input and output. This may be done through a gauze on the drainage bag or by draining urine into a bag into a graduate. Helpful hints. A uric catheter drainage bag should always be kept below the level of the bladder to allow for drainage. We continue. Indwelling catheters create a high risk of urinary tract infection. So the nurse aide must be meticulous when cleaning catheters and changing drainage bags. The connection between the catheter and drainage tube must be sterile. When reconnecting the drainage bag, the end must be wiped with antiseptic. When changing a bag, do not touch the sterile cap or plug that connects to the catheter to the drainage bag. Catheter care includes cleaning the exposed portion of the catheter from the meatus. Clean at least 4 inches of the tube. Catheter care may also include perineal cleaning. Helpful tips. Signs of urinary tract infection include reduced output, blood in the urine, and pain during urination. Report signs of a UTI to the nurse immediately. Skill evaluation. Provide a catheter care for female. 1. Check temperature of water for safety and comfort. 2. You put on your gloves. 3. Place a protective barrier under the buttocks. 4. Expose patients between the hips and the knees. 5. Sterile the catheter with one hand, being careful not to pull it. 6. Use a soapy washcloth and wipe downwards, away from the meatus, at least 4 inches. Use a clean section of the washcloth for each wipe. 7. Use the same procedure to rinse, then dry the catheter. 8. Cover the reposition of the patient. 9. Clean, store, and dispose of supplies appropriately. Condom catheters are secured over the penis with elastic tape to catch urine. They should be changed daily as a part of the perineal care. Use only the tape provided by the manufacturer to secure the catheter, while other types of adhesive may restrict blood flow to the penis. To apply a condom catheter, hold the penis firmly while unrolling the condom and leave a place of 1 inch at the top of the condom. Review question. When reconnecting the drainage tube to an indwelling catheter, the nurse aide should, I repeat, when reconnecting a drainage tube to an indwelling catheter, the nurse aide should clean the inside of the drainage tube with soapy water. B. Secure the drainage tube to the catheter with elastic tape. C. Hang the drainage bag above the level of the bladder. D. Wipe the end of the drainage tube with antiseptic wipe. And the answer is D. To reconnect a drainage tube to an indwelling catheter, the end of the drainage tube should be wiped with antiseptic to prevent infection. Okay, we're gonna end this part of the video so we're not too long, and then we'll continue at a later date. Thank you for joining. Have a great day.